Hello. So I wanted to do my presentation specifically on looking at anxiety that comes from imposter syndrome experiences, specifically in mental health professionals. And so I'm going to go ahead and hop on into the subject matter. So when we think about it, this is a bit of a plot twist, right? So it's something that we don't really think about when we first get into the profession, where you're like, yeah, I'm going to practice the very things that I teach my clients and everything's going to be great. However, imposter syndrome is something that's very real that a lot of professionals experience. And we'll talk about that a little bit too. But then also imposter syndrome in the mental health profession, right? So really looking at what that means, what it looks like, how it shows up. And then, of course, mental health professionals are not immune to this experience by no means. So, so as we look at imposter syndrome, we have to get to the root of it, and that's really looking at anxiety. So, anxiety disorders are involving marked and persistent fear, leading to impairment in life functioning, right? So this is something that has to be present whenever we are making a diagnosis of anxiety disorders. So when we specifically think about imposter syndrome, it is the experience of feeling like a fraud, feeling as though someone's going to find out that I don't know what I'm talking about, I don't know what I'm doing, I'm feeling incompetent, incapable, right? So a lot of things come up. And there's different types of imposter syndrome too when we think about it, right? You have your superhuman, right? I got to do everything and have to make sure everything's running smoothly in my life. I have to play all these roles and do it in such a way that makes me seem like a superhero, right? Also, there is experiences of perfectionism, right? I have to do everything perfectly. And if I don't, that means I don't know what I'm doing. Being a natural genius. Oh, yeah, I have to figure out ways to make sure that I know everything and I know how to do it. And it just comes to me naturally, right? Having all of these experiences can definitely show how this is tied very closely into anxiety, right? And so that's how we're going to kind of look at it from that lens. So, so with anxiety, this is something that happens to a lot of people. So 12-month prevalence rate of 7.1% and lifetime prevalence rate of 12.1% in the general population. So anxiety is something that is not uncommon, right? And then same thing is showing up when it comes to social anxiety disorder. And the reason why I want to bring up these two different types is because there is a social piece to imposter syndrome, right? So imposter syndrome does involve others are going to know that I don't know what I'm doing, so there's this element of feeling like I am a fake in front of my peers, in front of my colleagues, in front of, my mentors, my supervisors. So there is that social piece that's connected to it. So, what is the perfect storm that's happening here? Specifically, when it comes to mental health professionals, we have risk factors that make us very vulnerable to this occurrence. Also, there's this element of us having this fear of, okay, I have to practice what I preach. I have to know what I'm doing. I have to know exactly how to be the Zen person. But what if I'm not? Does that mean that I don't know what I'm doing? I can't control my own life. I can't make my own life perfect, right? So all of these things can cultivate this perfect storm when it comes to imposter syndrome and anxiety that manifests from it. So, so what are some risk factors that specifically hit home for mental health counselors? Being a new professional, right? So that puts you at a higher risk of compassion fatigue. You're just learning these things. You're just trying to figure out your grounding with this, right? You just went through and did those, practice runs in your class, and now you're getting out there doing it with a real client. So that can really create a lot more strain because you wanted to do it right. So that compassion fatigue and getting into a space where you're like able to be present with a client, but not always take it with you. Trauma caseload. So having a higher caseload percentage of trauma clients is going to also put you at risk, right? Because that compassion fatigue is going to be more likely to happen, be more prevalent. So that's going to put you at higher risk of imposter syndrome because of that risk there. Also, personal trauma history, right? So that can bring up things for us in the session and it can make it harder for us to do that. Also, it brings up these thoughts of like, okay, well, what if I'm not completely healed? And what does that mean? When I showing up to this client with this client and I'm telling them, how to do these things, and maybe I'm still walking my walk in this journey. And then also previous crime victimization is another element of it, right? So that empathy level goes up really high, which increases your compassion fatigue. But again, it can also have this element of, okay, they're going to figure out that I don't know what I'm doing because I can't get everything figured out in my life. I've experienced some of these same things happen to me, and how can I help somebody else through it, right? So sometimes that can come up when it comes to that imposter syndrome and the stress that can come from that compassion and empathy that happens. So the fake it till you make it factors. When you have low emotional separation from your clients, this can increase the risk of that compassion fatigue and your risk for feeling that imposter syndrome, right? Because it's like, okay, I can't separate these things. And so I'm feeling it very intensely. And am I supposed to feel this intensely? Like, how do I navigate this space? How do I figure this out, right? The importance of practice, right? So, what practices are we putting in place? Are they evidence based practices? Because if we don't understand how to conduct therapy, that makes it harder for us, right? It makes it really hard for us to be able to feel confident in what we're providing because we might not feel like we have our theoretical bearings yet. And then last but not least, coping, right? Maladaptive coping strategies can also make us feel worse, like we're faking it, right? Because again, we're teaching clients these coping skills. And so if we feel as though we're not doing these things, we're not showing up appropriately, we're not doing the things to take care of ourselves, but we're like, yes, self-care. We want you to make sure that you're doing wellness. We want you to meditate. And I'm not doing any of that in my own life. That can definitely feel like I'm a fraud, I'm a fake. So the science behind Zen. And And there is this science behind it, right? So the practice of mindfulness reduces compassion fatigue, right? So just being present with those feelings as they come up, right? Higher resilience and wellness, right? So lower compassion fatigue in counselor training, especially when we are practicing that mindfulness, being present with ourselves and not beating ourselves up about it, right? Mindfulness is a huge tool for wellness because it's about being proactive and not always reactive. Also, specialized trauma training helps too. Right. So, whenever we are being aware of if these feelings are coming up and I'm seeking out trainings in order to increase my knowledge base, then yeah, we're going to feel more confident. We're going to feel less like we're, you know, imposters and not sure of ourselves. And then evidence based therapy model use. So, when we do this, we are showing up as a professional and it helps us to feel more confident and capable in that space. So let's enter mindfulness in a little bit more in depth, right? So how mindfulness is integrated into anxiety treatment, especially with imposter syndrome, bringing it to present moment awareness versus future oriented worry, right? That is the basis of this, right? So instead of focusing in on everybody's going to figure out that I don't know what I'm doing, staying present with like, no, I'm doing the best that I can right now. I'm showing up with my skills. If I don't feel like I have something that I need, I can ask. I can get support. I can get help. In this moment, do I need it? Do I know that it's present if I need it in the future? And I will cross that bridge once I get there if I need it, right? So it's always bringing it back to the present moment. Also, when we think about mindfulness, it involves the non-judgmental observations of things that we're thinking about internally, things that we're experiencing externally, right? And so it allows for us to not say this is a good or bad experience. I'm feeling anxious right now. Yeah, I'm feeling anxious because I want to do a good job. I want to help my clients. I want to be present with them. I want to provide the best version of myself as a counselor, right? So when we think about it from a non-judgmental space of like, oh no, I'm a bad counselor. Oh no, I don't know what I'm doing. We're really sitting with, okay, why am I feeling this way? But I'm not going to say whether this is a good or bad feeling. I'm just going to identify it. I'm just going to sit with it for a second. And research shows that there is changes that happen, right? When we practice mindfulness, it helps us to reduce that stress because we're staying present versus shooting ourselves straight into the future. So when it comes to decentering, it's the ability to really observe the things as they come up versus creating scenarios in our minds, right? So this helps us to be able to say like, hey, It is okay for me to be present with the here and now. And, it allows me to sit with the thoughts of like, these aren't going to be here forever. This is present in this moment. They are not permanent. These are thoughts, feelings, and observations that I'm having in this moment, right? And that can be really freeing because it's like, okay, I've felt this way before. And then there's this element of this too shall pass because it's passed before in the past. So it's okay for me to experience it. This is a moment of suffering. Doesn't necessarily mean that it's something that I can't endure or be present with. This is just a moment. And I can be kind and gentle with myself in this moment while I'm experiencing this. So, when it comes to the mindfulness toolkit, we want to make sure that we have things that we are utilizing that can help us practice this. And a lot of these things we can actually do in the workplace, at home, on our time off, things like that, right? So, body scan. We can do a body scan really anywhere where we have a few minutes just to sit quietly and just check in with ourselves, check in with our body, and pay attention to the different sensations from head to toe, right? Sitting in meditation, right? So, just making our gaze a little bit more gentle and just sitting in the moment, paying attention to what we're experiencing. Another thing, too, is gentle yoga can be a part of that mindfulness practice. So, mindfulness based cognitive therapy combines the two approaches, right? So, I'm going to be mindful of what I'm experiencing, whether it's emotionally, physically, or, you know, even cognitively, right? And then actually spending time with those cognitive distortions that we might have and challenging them in the moment, right? Of like, okay, yep, this is hard. A lot of things are hard. I'm going to be present for the hard, right? So it's really about that reframing and being able to notice when cognitive distortions happen so that we can use those cognitive reframes and strategies in order to help us get through that moment. So evidence-based results do show that they are helpful, right? So mindfulness techniques are similar to what we can see in CBT when it comes to helping with improving anxiety symptoms. And, it can also improve just generalized anxiety disorders as well too. So kind of bringing it back to that imposter syndrome, right? So being present, being mindful, it allows for us to challenge thoughts, especially when we add in the CBT side of it too, right? So being present, mindful, paying attention to ourselves. So some ethical considerations, because of course there will be, right? All right. So when it comes to ethical considerations, boundaries of our competence. So when it comes to actually providing this service, we have to make sure that we are doing it in a competent way, that we know our limitations, that we know that we're getting the training before we just jump into doing these techniques. Because it can be harmful if we don't know what we're doing and we just try something out. Um, it does require education and training and supervision to help us to be the most effective in providing this service, right? Also, impairment. So when we think about it from even the counselor who is needing to address imposter syndrome, right? So that can cause impairment. So counselors monitor themselves for signs of impairment, making sure that we notice ourselves both physically, mentally, and emotionally, right? And knowing when to get support and help in those moments. And getting that assistance whenever we know that we are experiencing some impairment, right? If it's going into the point where our imposter syndrome is causing us to have panic attacks right before we go into certain sessions, right? We really need to pay attention to ourselves and get support and help in those moments so that we are being the best version of ourselves with our clients. Also, informed consent, right? So if you are providing cognitive behavioral therapy or, you're providing psychodynamic therapy, that's like with mindfulness, right? You want to make sure that you are informing your client, whether it is a client that has absolutely no knowledge of the different theoretical approaches or mental health professional of what they are going into with you. Excuse me. And then last but not least, making sure that we are aware of developmental and cultural sensitivity when we use this. Mindfulness is grounded in some Buddhist traditions, but doesn't mean that other aspects aren't incorporated in from different faiths and backgrounds. So making sure that we understand what that means, and then also understanding our clients and practicing it from a cultural humility side of things too, right? In order to make sure that it's like, no, I'm not going to push this on to a client that doesn't feel comfortable with mindfulness as a technique of using, right? So we have to be very aware of that and considering those things. And mindfulness might not be the answer for everyone, right? So the intensity and adherence to practicing regular meditation is not for everybody, right? And sometimes just being able to do that can be hard, right? So we have to be mindful that not every single client will this be effective for. And if it's not, then we pivot and we adjust and make sure that we are doing this in a very ethical way. And, just make sure that we are showing up and not forcing this onto clients. All right, here are my references. And I am so happy to be able to present this information. I'm really excited about sharing just kind of how, even as counselors, mindfulness can be a part of our practice and our journey. Thank you for listening.